Also, sorry, I look like freaking trash. Anyway, you guys, probably not by the way, have been wondering where the frick I have been. So I'll tell you, I recently had brain surgery. I had a cyst in my brain, or on my brain, and it was connected to the vagus nerve, which is like really important. It's like connected to your lungs, heart, and digestive tract. And they were, my doctor was hoping that it could somewhat help my nausea and vomiting for cycle purposes. And that was only like 2 months ago. So as of right now, I'm dizzy as hell. And yeah, so I'm hoping that it's too soon to tell, but I'm hoping that somewhere down the line that surgery will help something that's going on with me. I'm not in no hurry, clearly, because, you know, I've been living with this for so long that this is all I know. So it's honestly always just a waiting game, but I healed up really well from it. You can't even see the scar. So that was nice. Anyway, I was asked to do some questions and answers, but I have not, since I don't have a huge subscriber base right now, I just pulled questions from Google's Ask because that's basically what I'm doing. So yeah, there was a lot of questions, honestly, that I think are good questions that people ask, but it's someone that you don't know telling you who may not have cyclic vomiting, so I'm just trying to give my own voice on it in case, you know, you guys like that better. I have no idea. That is my dryer. That will go off a couple times. I apologize for that. So people want to know if cyclic vomiting is fatal. It is not fatal. The disease itself cannot kill you. However, if you have heard of aspiration while vomiting, that certainly can. I've aspirated a couple times. By a couple, I mean almost every time I vomit. I have not died yet, so that's cool. Also, I'm just gonna let you guys know that I laugh a lot because, it's a coping thing. So, yes. So yeah, it's not fatal, but you can die if you swallow and inhale your vomit while you are halfway in a coma. That can happen. Next question, is there a cure for cyclic vomiting? There's not necessarily a whole cure, but depending on how your cycles are, there are treatments that you can do. However, there's no treatment that has worked for me, really, that has kept me out of the hospital because it's a very violent thing, and when you throw up, there can be blood that comes out, which is very scary, and that's not supposed to happen. So then you go to the hospital for things like that. But as in a cure, no. There should be, though, let me say, because honestly, it is not, okay, I'm not gonna get into it because I will literally rant for days, but anyway, so what can trigger a cycle? Really anything, any emotion possible, like excitement, fear, sadness, depression, anything can put you in a cycle. There's been times where I have missed my best friend's birthday party because I was so excited to go, but then I missed it because I was too excited and my hormones got all messed up. Also, if you're a female with cyclic vomiting, hormones play a really big part, as if, like, you're on your period. You can feel like crap 10 times more than a period will also make you feel like. So it's really, really fun that way. How does a cycle last? It depends. Honestly, I am lucky because there are people that I have heard that vomit for like literally like weeks. Every single day, a lot. Like a lot, a lot. And for me, I'll vomit about 2 days more than like 200 times. So, in that sense, I'm lucky. But vertigo wise, I'm dizzy every day. So, every day feels like a small cycle. But when it really hits, it's debilitating, honestly. So, it really just depends on you, on the person, on anything, really. But yeah, so how is cyclic vomiting syndrome diagnosed? I was diagnosed because my mom would write down every single time I had a cycle for my whole life, and I was diagnosed when I was really young, but they knew because if you go to a doctor and you show, you know, proof you're in the hospital that you vomit in cycles, that you're dizzy all the time, it's basically a common sense thing. It doesn't show up on any tests, so no X-rays, no MRIs, no blood tests. It is not something that you can just look up and rule it out. You literally have to rule it out yourself. So, and that, yeah, okay. Next. Okay. People want to know if cyclic vomiting syndrome is a disability. Yes. Um, People may not look at it as a disability though, because on my last video I said this, I think, is because there is no physical, like, thing. Like, I do not look like I should be going to a hospital pretty often, but I do, and I am that person. So, another thing that I actually want to mention is that if you know somebody or have heard of anyone who has cyclic vomiting syndrome, don't judge them because you do not know. Yes, they look like a normal person by sense, but have like people go through their own things. You do not know how somebody feels. Um so yeah. Um Another thing that I want to actually talk about that is not a question. So if any given time, it is in the future or whatever, you now, right now, have heard of cyclic vomiting syndrome. You know that it is horrible and you're dizzy, you cannot walk, you cannot move, you're vomiting, right? Can't drive, you can kind of barely speak. So, say someone is at a grocery store and you see them and they just pass out vomiting. I would hope that somebody would go to them and ask them if they can help them, what is wrong. If they say that they have cyclic vomiting syndrome, honestly, the first thing you should do is probably ask them if they have a, person that they contact when they go through a cycle. If not, definitely call a fucking ambulance because, it's fucking scary, and if you're by yourself in a store and you just drop to the ground not knowing anything what's going on, it's gonna probably be your worst day ever. And if someone's around that is healthy and could help them, that would be cool. So I know that probably wasn't really necessary to say, but honestly, if I was that person in the store that passed out vomiting, I would want somebody to help me because I cannot do anything by myself at those times. So yeah. So a good question is, does a lack of sleep like affect a person with cyclic vomiting? And yes. That is honestly one of my biggest problems, to be honest. I do not get good sleep because I have insomnia. I cannot go to bed easily. So Getting a good night's sleep is just so important. If I get less than like 7 hours of sleep, I'm not kidding, I will be nauseous all day and have the worst headache of my life. Every time too. So it's not like, it's, sleep is important. Everyone, anywhere, no matter what your life is, you should get good sleep no matter what. But especially cyclic vomiting syndrome patients. But another thing that I thought was really neat, I do not know, I'm not gonna say what it's called, I guess, because I don't want to get sued for anything, because I don't know rules, you know. But in the hospital, I was after my brain surgery, I had a cycle like right after that, which was horrible, by the way. Anyway, I was told that there was this gel type thing that you can rub on your stomach for nausea, and it has like peppers in it, so it's like a really hot like substance. By the way, that shit works for me, at least. I don't know why I wasn't given it, like, you know, freaking 19 years ago, but I have it now, and honestly, it's great. So if you have nausea, just go hit up your doctor and say, hey, is there an ointment that I can use that will soothe my stomach pain? And hopefully they'll know what they're talking about and give that to you, because you deserve it if you got that nausea, let me tell you. So I don't really know any more good questions that I could find. A lot of them are really repetitive. So if there's any questions that you guys want me to answer, feel free. If there's something that I didn't explain well enough, go ahead and yell at me. Go for it. Attack me. You know, do what you gotta do. Clear off your chest. I don't know. But yeah, so I'm hoping to make more of these videos if you guys want. They're important. People don't really know about this stuff, so I will be the voice, I suppose, to people who know a little bit less than I do. But yeah, also, I'm gonna start putting more music up on the channel because I got my computer now. I know I talked about that before. I got it. So we're in the business, baby. That was really annoying. Okay, anyway, so thank you guys for watching. If I could learn to put clips or pictures in a video, I will, of my surgery process and of all the lovely staples that were in my head. So yeah, I hope you guys have a wonderful rest of your day, whatever day this is that you're watching it on, and stay believing.